Today, we're diving into a topic that affects millions of people worldwide: anxiety disorders. Whether you're experiencing it yourself or supporting someone who is, understanding anxiety is crucial for a brighter, healthier future. So, let's embark on this journey together. Chapter 1. What is anxiety? Let's start at the beginning. Anxiety is a natural human emotion. It's that fluttery feeling in your stomach before a big presentation, or the nervousness before a first date. But when does it become a disorder? Anxiety disorders occur when these feelings become excessive, persistent, and start interfering with daily life. Imagine having a constant companion of worry, fear, and unease. That's what it feels like for someone with an anxiety disorder. It's not just being nervous. It's a relentless cycle of intrusive thoughts and physical symptoms that can be overwhelming. Chapter 2. Types of anxiety disorders. Anxiety isn't one size fits all. There are several types of anxiety disorders, each with its own set of symptoms and triggers. 1. Generalized Anxiety Disorder, GAD. This is like the worry monster on steroids. People with GAD experience excessive anxiety and worry about a wide range of things, often with no specific trigger. 2. Panic disorder. Ever felt like you were having a heart attack out of the blue? That's what a panic attack feels like. Panic disorder is characterized by sudden, intense episodes of fear, accompanied by physical symptoms like a racing heart and shortness of breath. 3. Social anxiety disorder. Picture this. You're at a party, and suddenly, it feels like all eyes are on you. That's the reality for someone with social anxiety disorder. It's an intense fear of social situations, where the person is afraid of being judged or embarrassed. 4. Phobias. From spiders to heights, phobias are irrational fears that can send someone into a panic just thinking about them. 5. Obsessive-Compulsive Disorder, OCD. OCD is like having a broken record in your head that won't stop playing. People with OCD have recurring thoughts, obsessions, and rituals, compulsions, that they feel compelled to perform to ease their anxiety. Chapter 3. Signs and symptoms. Anxiety disorders can manifest in various ways, both mentally and physically. Here are some common signs to look out for. 1. Excessive worry or fear. 2. Restlessness or irritability. 3. Trouble concentrating. 4. Muscle tension. 5. Sleep disturbances. 6. Panic attacks. 7. Avoidance behaviors. Recognizing these signs is the first step towards seeking help and support. Chapter 4. Causes and triggers. Anxiety disorders don't have a single cause. They're the result of a complex interplay of factors. 1. Genetics. There's often a family history of anxiety disorders, suggesting a genetic component. 2. Brain chemistry. Imbalances in neurotransmitters like serotonin and dopamine can contribute to anxiety. 3. Environment, traumatic events, chronic stress, and major life changes can all trigger or exacerbate anxiety. 4. Personality. Certain personality traits, like perfectionism or a tendency toward negativity, may increase the risk of developing anxiety. Understanding these factors can help us better grasp the root causes of anxiety disorders. Chapter 5. Coping strategies. Living with anxiety isn't easy, but there are plenty of coping strategies that can help manage symptoms and improve quality of life. 1. Deep breathing. Take slow, deep breaths to activate the body's relaxation response and calm your mind. 2. Mindfulness and meditation. Practice being present in the moment and observe your thoughts without judgment. 3. Exercise. Physical activity is a natural stress reliever and mood booster. 4. Healthy lifestyle. Eat a balanced diet, get enough sleep, and limit caffeine and alcohol intake. 5. Therapy. Cognitive behavioral therapy, CBT, and other forms of therapy can provide valuable tools for managing anxiety. 6. Medication. In some cases, medication may be prescribed to help alleviate symptoms. Remember, it's okay to seek help and explore different options until you find what works best for you. Chapter 6. Breaking the stigma. Despite being one of the most common mental health conditions, anxiety disorders are still surrounded by stigma and misunderstanding. It's time to break the silence and start the conversation about mental health. 1. Education. Learn about anxiety disorders and spread awareness to dispel myths and misconceptions. 2. Compassion. Be kind and supportive to those struggling with anxiety and offer a listening ear without judgment. 3. Advocacy. Advocate for mental health resources and policies that prioritize access to care for all. Together, we can create a more inclusive and understanding society where everyone feels empowered to seek help without fear of judgment. And there you have it, folks. We've journeyed through the maze of anxiety disorders, armed with knowledge and compassion. Remember, you're not alone. Let's continue to support each other on this path to mental well-being. Until next time, take care and be kind to yourselves.